Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor, available on Amazon. Probably the most important specialist on a cancer survivorship care team is going to be a cardiologist. And really, if possible, it should be a cardio oncologist, as they may be more experienced with the potential for long term side effects on the heart from treatments, both radiation and chemotherapy. Now, I've got to talk about this in two different parts because both really kind of have an impact on the heart in their own ways. Long term radiation side effects, which is commonly known as radiation induced heart disease, um, this can appear decades later, including accelerated coronary artery disease, valve damage, heart failure, and arrhythmias. And those that are probably going to have higher chances of developing these issues are those that receive chest or breast radiation, left-sided radiation, particular if you're dealing with doses over 30 grays. Now, in my case, I received 40 grays of radiation to my upper body. It was considered scattered field, so the whole area up here, got hit with that. I was diagnosed in 2008, 18 years after my treatments ended, with the first of many heart issues, a widowmaker blockage of my left anterior descending artery. So if you look that up on Google, you're going to see that's one of the main arteries going to the heart. If that gets blocked, that's why they call it a widowmaker, because you're not expected to survive that. Now, the key long-term side effects, like I mentioned, cardiac or coronary artery disease, valve disease, the increased risk of heart attack, uh, the valve disease. You'll see reports saying calcium buildup, fibrosis, the leaflets become stiff, which is referred to as stenosis, or leaking, which is regurgitation. Heart failure, also known as cardiomyopathy. The heart muscle itself becomes stiff or thick. Again, this is fibrosis, which makes it harder for the heart to pump and puts you in what's called congestive heart failure. Pericardial disease, this involves the thickening of the pericardium, which is the sac around the heart. That can cause chest pain and swelling, and of course, arrhythmias and conduction system issues. Damage to the heart's electrical system can cause irregular heartbeats, such as AFib, which is not good, or conduction. When we get involved in talking about long-term chemotherapy side effects, also known as cardiotoxicity, and that's why I mentioned the advantage to having a cardio oncologist as opposed to a standard cardiologist. Both are good, don't get me wrong. I've been taken care of by a cardiologist for the last 17 years. I am now seeing a cardio oncologist. Um, Damage to the heart can happen within the first treatment, actually, or it can occur decades later. Serious conditions like chronic heart failure, cardiomyopathy, which is the weakened heart muscle, coronary artery disease, arrhythmias, and in some cases, valve damage. Um, these particular risks are particularly high when it comes to anthracyclines, which can cause permanent dose dependent damage. Now, I have talked about these anthracyclines, most commonly adriamycin, or doxorubicin is another one. Um, that is very common in the treatment for Hodgkin's lymphoma. We call it the red devil. But here's the thing: Adriamycin and doxorubicin is also used in treating breast cancer. So this drug is used on a number of cancer patients, not just a small number of Hodgkin's patients, but a large number if you include those uh, going through breast cancer and possibly other cancers as well. Now, supposedly, the number of people impacted is like 5%, but for those 5%, this side effect can be fatal. And so you want to be on top of that. And after doing some research, I have a pretty good series on using the red devil. A scientist that I met and interviewed who found that using a 2D ultrasound can actually pick up the heart damage as it's beginning and proceeding. So basically, he told me that you could pick up that damage as early as the first treatment. What does that mean? That means that if necessary, you can alter the treatment or stop it altogether once they start seeing heart damage from adriamycin or doxorubicin. And that's crucial. So, long term side effects from chemotherapy can be heart failure and cardiomyopathy, um, coronary artery disease, which is blockages, can be seen as high blood pressure, heart attacks, arrhythmias, structural damage, thickening, scarring of the heart, and damage to the heart valves. And this was something that just came up in recent years through the Cleveland Clinic and other facilities that have recognized that cancer survivors who undergo chemotherapy and radiation therapy have what's called accelerated aging, especially when it comes to the cardiovascular system. That survivors can appear at least 10 to 15 years older internally than their actual age. Um, so the key is for survivors when you're done with your oncologist, and actually it should be done uh, when you're done with your treatments. Make cardiology a regular part of your cancer survivorship team. When you're done with your 5 years, you hit that mark. That cardiologist is as important as your primary care doctor. Regular follow ups that you get EKGs, echocardiograms to check your heart function are recommended to manage these risks. Now, uh, in regards to late side effects, I'm going to go through my list. I'm not going to describe what they are because I don't have that time to do that. But I'm going to rattle them off. Here we go. Left anterior descending artery. That's the main artery going to the heart, blocked 90%. The right coronary artery, also another main artery going to the heart, that was blocked. Aortic stenosis, okay, that was the aortic valve. That hit severe before I needed to have surgery on that as well, in the form of a TAVR. Basically, that one was not done open heart. That one was done through transcatheterization. Mitral stenosis is another. That's a valve that's being watched. I also have a murmur. I have what's also called a left bundle branch block, and probably the most jarring, besides being told I have a widowmaker, is the diagnosis of congestive heart failure. I have that label. And something that came up on my last cardiac follow up, I have a new diagnosis called myocardial ischemia. ISCHEMIA. So you can look up all of these on Google. Those descriptions are fairly accurate, and you can see what I have to deal with. Now, again, not everybody develops these late side effects. Some develop less, some develop more. The only way to know is if you're being watched by a qualified doctor. And in this case, when it comes to the heart, you want to make sure you're followed up by a cardiologist or a cardio oncologist. Until next time, this is Paul's Heart.